Okay.
Okay. Front.
Okay.
Back. Okay. You look for the intraventricular sulcus. Okay, so this is left side. This is right side. Left ventricle, right ventricle. Left atrium, right atrium. The flaps on the top. Okay. The vessels. The one that's most anterior here, it kind of runs this way across the face of the heart. That's the pulmonary artery.
Okay.
Okay, that's blood out to the lungs. Okay. The big one that's almost straight up and down, that's the aorta, blood out to the body. This little branch right off the aorta, that's the brachiocephalic. Okay.
I keep saying brachiocentric. Is that something else?
Yeah.
Maybe.
On the back of the heart, you have your veins coming in. So you have your oh, that heart you don't. Oh, let's try this one.
There was one that went through the vena cava.
Yeah. Okay, this one's ripped, but there. This one's cut. So on the back of the heart on the right side, okay, so this is your right atrium here, this is your left atrium here. So on the back on the right side, you have your superior vena cava coming down, your inferior vena cava coming up, and they both dump into the right atrium. And then on this side, and these have all been cut, but coming in here would be all of your pulmonary veins coming back from the lungs, and those go to the left atrium. Okay? The ligamentum arteriosum, that's what I was looking for before. That is an actual physical connection in utero between, and cut so close. On some of them you can see there's a little bridge of tissue that connects the pulmonary artery over to the aorta, and that's the arteriosum. That used to be open because in utero you don't use the lungs, so there's going to be the same blood out to the lungs, so it just goes right back to the systemic circuit through the aorta. Okay? And then if we open up our heart, okay, again, this is the apex, this is the bottom of the left ventricle. Okay, and here's a nice view of the cusps, the valves between the atrium and the ventral, the cuspid valves. This is the left side, so this is the bicuspid valve. This is half of it on this side, and this is your other half over here. Okay, those cusps, or those flaps of tissues, are anchored to the walls of the ventricles by the chordae tendineae. Okay, and where they're anchored down here are the papillary muscles. Okay, so anywhere you see one of these little tendons hooked, that's a papillary muscle. Okay. Also down here on the wall you see all this muscle over here, that's trabeculae carneae muscle down here, because this is a really muscular side. Okay? On the right side, again, not so much myocardium here, right, as opposed to here. And you have a tricuspid or three-part valve on this side. Again, it's anchored by the chordae tendineae to the papillary muscles on the wall of the ventricle. Okay? There's also valves between the ventricles and the vessels going out of the heart. So our blood would come in here, our left ventricle, down in here, the ventricle contracts, and sends it up through here, which is the aortic semilunar valve that regulates flow out through the aorta. Okay? And there's also a semilunar valve between, oh, it's cut right to see that.
I think there was one cut.
There's a semilunar valve between the pulmonary, is that one that I just had? Between the pulmonary vein and the pulmonary artery. No. See, this one's cut here, but the valve is gone. Oh no, wait, here's part of it right there.
Yeah.
Yeah, because that's coming out the pulmonary artery, which has been partially cut. The pulmonary semilunar valve regulates flow from the right ventricle out into the lungs.
That's hard to see if it's not
If it's
cut
not cut,
into, right?
yeah, if it's not cut, usually if it's cut properly. Oh wait, that's on this side. Here it is.
Yeah, there it is.
There
I
it
cut
is.
it down, right
Yeah.
down.
If you cut the whole thing all the way down, then you can see.
Yeah.
Just again, just little flaps of tissue. Right now. This is your moderator band that's in the right ventricle. Oh, we're good.